privacy, close the door. I'm going to wash my hands. Okay. My patient is sitting upright on the cart. His facial expression is symmetrical. His eyebrows are symmetrical. His eyes are symmetrical. His nose is midline. Lateral aspects of lips and nasolabial folds are symmetrical. Can you please tell me what today is, your name, and where we are?
Wednesday, Keith, and we are at Ashley University.
Okay, he is alert to person, place, or time. Alert and oriented times 3. Okay. Now I'm going to feel your head, okay? So I'm moving his scalp around, if you can see. Okay. I'm assessing the mobility of his scalp, and I'm checking for any abnormalities. Okay. So his scalp is mobile. And then I'm going to check also for any lesions or open areas. So I'm going to move the hair and I'm going to look at the scalp. Okay. So I see no lesions. Okay. Now I'm going to look at the hair. All right. He has blonde hair, short, it's short, it is shiny, and I do not see any split ends. The ends are intact. Okay. And his hair is clean. And then when you look for presence of parasites, a lot of times you look behind the ears, at the base of the neck. Those are the places that they really like to, you'll see a lot of nits if someone does have lice. So you're looking throughout the hair, checking for any parasites that might be in there, or any of their eggs. So no lice or nits are noted. And I'm looking at his hair to see if he has any hair loss. So he has a full head of hair. If someone does have some hair loss noted, you just note the alopecia, okay? That's what the hair loss is. All right, so now I'm gonna look at his face again, and I'm gonna say his distribution of eyebrows are symmetrical, okay? His eyebrows are full and symmetrical. Superior and inferior eyelash distribution. So his eyelashes look full and they are symmetrical, okay? And then the palpable fissures. I know you guys were looking at that yesterday. So you're looking in between here where the eye opening is on both sides, and you're looking at the top and the bottom, and you're looking to make sure that those are symmetrical and even, that someone doesn't maybe have an eyelid droop or something else going on with their eyes. So you're gonna say some palpable fissures are symmetrical, okay? And then I'm going to look at the color of his irises. So he has blue irises, and his sclera is white, and his conjunctiva, and we're looking at the bulbar and palpable, so you pull down, okay? So clear and pink, because you're looking at both the bottom eyelid and you're looking at the white of the eye, okay? And then, oh, I don't have a pen light on me. Who has a pen light on me? Okay, so now we're going to assess cranial nerves 2 and 3. So I'm going to assess what his pupils are at resting. So his resting is a 5. Okay. I'm going to shine this light into your eyes. I'm going to have you look straight ahead for me, okay? Then I'm watching his pupils react to the light. Now I'm going to move my pen towards your nose, and I'm going to have you follow the pen, okay? So then I'm watching his eyes converge towards the light, and I'm watching his pupils react, okay? So his pupils went from a 5 to a 3, and his eyes are perla. The pupils are equal, round, reactive to light and accommodation, and cranial nerves 2 and 3 are intact. Okay. All right, so now I'm going to assess your carotid artery. Okay, and you do that one at a time. Okay, so they are symmetrical in 2+ amplitude. Okay. So now I'm going to use the belt, and I'm going to auscultate the carotid pulses. No bruits auscultated. Okay. All right, so now I'm gonna look at his upper extremities. I'm observing. This is my observation. So the color, can you pull up your sleeves for me as far as you can? I mean, yeah, as far as you can get them up there. You might wanna take, we're almost there, so. You wanna be able to observe all of the upper extremities. Okay, alright. So his skin color is pink. So you're gonna wanna feel both upper extremities. Okay. Upper extremities are warm. His skin feels dry. Okay. Integrity, I'm looking to make sure that he doesn't have any open areas on his upper extremities, and he does not, so his skin is intact. His texture is smooth. Okay. His turgor, so I'm gonna assess his turgor. You can do it on his hands. Turgor is brisk, so you just pinch up a little bit. It's a brisk and a normal finding. If it stays at all, that's called tenting. Sometimes with dehydration, you see that. On elderly people or older people, you want to check up by the clavicle skin turgor because their hands lose elasticity. So that's the best place on the older people. Okay, and then we're assessing for any edema. So I'm assessing bilaterally. Make sure you're checking bilaterally because it could be different on one arm versus another arm. So you want to make sure that there's no edema. So no edema present. Okay. Okay. Now I'm going to check his pulses. So I'm going to have you hold your arms up for me, please. I'm going to check the brachial pulses. Brachial pulses symmetrical +2. Radial pulses are symmetrical and +2. Okay. And then can you please hold your hands up for me? I'm going to check capillary refill. You check it on both hands, okay? So capillary refill is brisk. Can you put your fingers like this for me, please? No presence of clubbing noted. Okay, so I'm looking at the fingers for clubbing. All right. Can you please squeeze my hands? Hand strength is 5+ symmetrical. Can you please put your arms up like this for me? Can you pull towards you? Push towards me. Can you push inwards? Push outwards. His strength is 5+ symmetrical on bilateral upper extremities. Okay, so can I please have you lay down for me? Now I'm going to look for his PMI. I'll raise the bed up. So I'm going to find your point of maximal impulse, which is at the 5th intercostal space, left mid-clavicular line. So I find the left clavicle, and then I count down 5 spaces. I forgot how to do this. And there it is. So I've palpated his PMI. Okay. And then I'm going to change it over to my diaphragm. I'll try to describe it. And this is where you'll listen with us for a full minute for the apical pulse. Okay? So just remember to listen for a full minute for that. So I'm going to say I won't listen for the full minute at this point, but just for time purposes, I'll say his apical was 70 and it was regular. Okay? So now I'm going to listen to the vowel sounds. I want to make sure my bell is working, okay? So I'm going to start with the aortic, which is to the right side of the sternum in the 2nd intercostal space. So just make sure you're staying to the right side of the sternum. No murmurs or extra heart sounds noted. So then I'm going to go to the left side of the sternum, in the 2nd intercostal space. No murmurs or extra heart sounds noted. Now I'm going to be staying on the left side of the sternum, and I'm going to count down 4 intercostal spaces. No murmurs or extra heart sounds. That's the tricuspid. So I did aortic, pulmonic, tricuspid. Now I'm going to go to the mitral, which is in the left midclavicular line, 5th intercostal space.
Notice that she's feeling the intercostal spaces.
No murmurs or extra heart sounds heard, so I listened for a couple of seconds to make sure I didn't hear any of those things, okay? So it's not just placing your stethoscope in the correct place, you have to listen for those actual sounds, okay? You have to know what you're looking for with that. Okay, can you please sit up for me? Go back down a little. Okay, so I'm observing him sitting there. I'm looking at his respirations. His rate is within normal limits and his rhythm is even and non-labored. And I'm looking again up here at the upper torso. So skin color is pink. His facial expression is relaxed. There's no use of accessory musculature. And I have assessed capillary refill and it was brisk and there was no clubbing noted, okay? If you want to do it again, that's totally fine, but if you've assessed it once, you don't have to assess it a second time. You can just say you've done it and your findings for that. Can you please stand up for me? Okay, so I want to show you AP to T, okay? So AP to T, we're measuring the diameter, okay? We're checking for lung disease. Sometimes lung disease causes that barrel chest. So you want to make sure you're putting your hands on the side of the person, okay? You're checking to make sure that that is one hand, okay? And then you're checking in the back, okay? You're putting your fingers together back here and you're waiting for them to breathe in and out because you want to make sure it's a 1 to 2. That's a normal finding. I'm going to have you spin around. Okay? So when you check AP to T, you go 1 to 2 is a normal finding. If they have lung disease, you'll see where their chest becomes barrel chest and it expands and it's going to be more than one hand over here. Okay? So that would be your abnormal finding. So AP to T is 1 to 2. You sit back down for me, please. Now I'm going to listen to your lungs. Every time that my stethoscope touches your skin, I'm going to have you breathe in and out for me, okay? If you feel lightheaded at all, please let me know, and we'll stop for a few seconds. Okay. And you start supraclavicular, and you go contralateral. Whatever you assess on one side, you want to assess on the other side, okay? You want to make sure you're not listening over any bones. Stay off the sternum. You don't want to listen over breast tissue. You want to make sure you're staying over the rib area. You don't want to listen too low. And just make sure you're listening on one side, you're going to the other side and listening in the same place. Okay? Alright, I'm going to have you lean forward slightly and put your weight on your arms. Same thing in the back. You're going to want to go contralateral, staying off of the spine, avoiding the scapula areas, and contralateral. You want to listen to the full respirations in and out. There can be different sounds in than there are out, so you want to listen to the full respiration at each spot. Okay, you can sit up for me. Okay, I'm going to have you lay down for me, please. If you feel like it, you can bend your knees if you need to. Okay, so I'm going to get down and I'm going to look at his abdomen. I'm going to look at the shape of it. I'm observing. We're back to observing for the abdomen. Okay, his abdomen is flat. I'm going to check the integrity of his skin on his abdomen, and it is intact. The skin is intact. The umbilicus is inverted. There are no adornments noted. Okay. Now I'm going to listen for vowel sounds. I'm going to auscultate. Check my diaphragm. And you listen into places in each quadrant, okay? And when you do that, you want to make sure that you start in the right lower quadrant, okay? You're listening over skin. You need to scoot their pants down a little bit, that's okay. Make sure you're not going too high, so if you need to feel the ribs to make sure you're down in the abdomen, do that. 2 places in each quadrant, and you're listening for vowel sounds, so it might take a minute before you hear one. You're assessing that the vowel sounds are present, and you're noting if they're normoactive, if they're hypoactive or hyperactive. Okay, 2 spots in each quadrant. All right. So his vowel sounds were present in all 4 quadrants, and they were normoactive. Okay. And now I'm going to verify my bell side of my stethoscope. Right, and now I'm going to listen to the abdominal aortic artery. So like we said, that's above your belly button and slightly to the left. Okay. No bruits auscultated. Okay. So now we're going to go on to percussing. Same thing as auscultating, you're going to percuss in 2 spots in each quadrant, okay? So you're going to start in the right lower quadrant and work your way around. Timpani was heard in all 4 quadrants. Okay. And now we're going to lightly percuss, just 1 centimeter. Okay, and we're going to start in the right lower quadrant, and you do 2 places for that also. Oh, sorry, that's what I meant. Thank you. So I palpated lightly, 1 centimeter, 2 spots in each quadrant. Okay, I'm looking for any tenderness. Are you having any tenderness? So no tenderness and no mass is noted. Okay. Can you please sit up for me? No, you guys can come over here for that. I'm going to be at the lower. We're doing lower extremities now. So I'm going to have you pull that up. Can you take your socks off for me, please? Okay, so now we're down to feet and legs. So now I'm looking at the skin color of his lower extremities, and his skin color is pink. Temperature, I'm going to want to feel upper legs, lower legs, and feet. You want to note any discrepancy or changes between any of those. Okay, sometimes the upper extremities may be warm and the lower extremities may not be warm. So it's good to assess the whole leg and the whole foot. Okay, so his temperature temperature is warm. His skin is dry. Okay. Integrity, I'm looking for any open areas. I'm inspecting his feet and his legs. So you want to make sure you're, especially on your diabetic patients, you're inspecting their feet really well because they could have areas between their toes that they don't even know or see. Okay, so his skin is intact. His texture, I'm feeling the texture of his legs and it feels smooth. And I'm assessing his skin turgor on his legs. So this turgor is brisk. Okay, skin turgor is brisk. And I'm assessing over the tibial area for edema, and you can do the ankle area. Okay, but you want to assess in those places for any edema, so no edema noted. Okay, so now I'm going to look for the dorsalis pedis pulse, and I'm looking for those together. They're symmetrical, 2+. Okay, now I'm looking for the posterior tibialis, posterior tibial pulses. They're symmetrical and 2+. Okay. All right, so I'm going to have you, I'm putting my hands on his lower legs. Can you please push towards me? Pull towards you. Push inward. Push outward. Can you push down like a gas pedal and pull up towards you? Okay. Bilateral leg and ankle and foot strength is +5 symmetrical. Okay. Does anybody have any questions?
You forgot the ankle and foot.
Oh, I did it together, but I can do it separate.
Sorry,
Let me do that separate. So, push out. I'm on his lower legs. Push in. Push out. Pull back. Leg strength is 5+ symmetrical. Can you please push your feet up like a gas pedal? Can you push it down towards the floor? Ankle and foot strength is 5+ and symmetrical. Okay. Does anybody have any questions about any of that? So just make sure you're really looking at all of your observing